Okay, hi guys. Welcome back to TGO Podcast. Today I am joined by Kosalaa. Kosalaa, welcome to TGO Podcast. How have you been?
I've been good, thank you. Just got a slight cold right now. Just, self-isolating at the moment. Following the government rules.
What is that? COVID? Or it's just
Pardon?
like a regular cold? Is that COVID or just a regular cold?
I've got COVID, yeah.
Oh, really? Oh,
Yeah.
sorry to hear that.
Yeah.
Like,
So,
how is, like, is
yeah.
it something that has really affected you? Like, or?
Well, work-wise, yes, it has kind of affected me because I can't go into work for 10 days now. I've lost my taste and smell. I've got a blocked nose, as you can hear. It's not a great feeling when you lose your taste and smell because it's just like you're so dependent on it.
Yeah, I suppose you never know how important it is until you actually do lose it. Oh, I'm so sorry to hear about. Where exactly? What industry do you work in, or what do you do?
I work in a GP practice, so I'm an admin staff member. So even though I wasn't exposing myself to patients and even when we had to go downstairs to, like, let's say the main area, like the reception area, or to collect post, we would have to wear a mask. So we were really, really vigilant. But I can't say where I got the COVID from, because since they're saying there's a new variant, they're saying that it's spreading very quickly. So none of us know where we got it from.
Oh, that's a shame. Like, do you guys wear, of course you wear masks, like, do you wear gloves, like, around the practice as well?
Yeah, so we're like literally we're supposed to be in other areas. So if we're an admin, we're an admin. We shouldn't be like going downstairs too often. We should only go downstairs if necessary, just to not let this like germs be spreaded or have a contact with other people, just because the fact is we don't know where the staff members go. Like after work, we don't know if they're going to mingle with other people or if they're going straight home. So obviously that's why we have to keep our distance with our work colleagues as well.
No, that's totally understandable. Have you had any other symptoms apart from losing your taste and your smell and then feeling a bit poorly?
It was just my blocked nose. That was literally the symptom that I had on I woke up on Boxing Day feeling all bunged up, and I was just like, great, I can't go back into work until I get tested. So I immediately went to the testing center on the Boxing Day and received the results on Bank Holiday Monday. And yeah, they said I have to self-isolate until the 5th of January.
And have you been in contact with anyone else since that time, or was it just you?
It was just myself. Like I literally just been at home. Like I have only been with my family, my mum and dad, but I've just been at home self-isolating. I'm just in my room. I can't go anywhere else, but just stay in my room basically. Yeah.
Are your parents self-isolating as well, or is it just you in your room?
Yes. No, okay. So obviously I'm self-isolating in my room. My parents are self-isolating. My dad's self-isolating upstairs. My mum's self-isolating downstairs, because they've said it. If one family member gets a test that's positive, then the other family members have to self-isolate for 10 days as well.
I mean, I would imagine, but I have a feeling there are some people that have tested positive, or there are some people that have come in contact with people that have tested positive and they don't isolate. And I kind of have a feeling the virus just continuously keeps spreading. Because, like, for instance, if we say saw each other, okay, maybe like the week before Christmas, we don't know whether you had that virus before then.
Exactly,
so if you tell someone, the chances of them isolating is just like, now people are just like, I don't know why people are not listening.
Yeah, they're not. I think they're just not respecting it in that kind of sense, because as I'm working in the NHS, I kind of see what's happening, and it's just really, really scary. And even getting these test results on Monday, I would burst into tears because I was so scared for my life. Like I lost my taste, I lost my smell, and I was just like, oh my God, please let me not now feel weak to my bones. Like, so Touchwood, I haven't been feeling like that. I've been having plenty of liquids, taking all the medication that I have to take.
Yeah.
But it's like, it's not a nice feeling. Like, I don't know if it's helping, but you still have to take it. So
yeah. Wow. Like, are these like medication? Have they been given to you by a doctor, or is it something that you just?
No, it's just like if you've got cold, flu like symptoms, just take the normal like night nurse or Beecham's paracetamol, just to keep your immune system, try and fight it off, basically.
Oh, wow. Well, I hope whoever's watching this or listening to this take notes to stay away from public places. I mean, it's really scary. I don't even want to go downstairs to the shop. I just literally want to stay in my house.
Like, I think during the Christmas period, because I only do a weekly shopping for the household, and right before Christmas Day, like I think Monday all the way till Wednesday, Thursday, I think I was going to like different shops, which I usually don't do, and I feel like I probably picked something from at that point, because like even when I was walking by people, they were just coughing, and it's just like, why are you outside if you're coughing? Like, have you actually been tested? Have you actually self-isolated? It's like all these questions running through my brain when I hear a person cough or sneeze, or it's all those questions that run through your brain. Have they self-isolated? Have they taken the test? Are they not taking things seriously because the government's not giving the right information?
Yeah. No, I could imagine, of course, some people are probably like frustrated with like the whole lockdown. And then, we can now go outside, and then like you can't now go outside. It's like so many mixed messages. You get so confused, and people have probably just reached to the point where it's just like, it is what it is. Like, if I get it.
Yeah, I think it's because of the whole, like the government doing this whole tier business, like tier 1, tier 2, 3, tier 4. It's like, stop doing those, just put England into a lockdown completely. Like how I think Ireland, they're from the 31st, they're complete lockdown for 6 weeks. And I think even Scotland is doing the same thing, from the 31st, lockdown for complete 6 weeks. So I'm just like thinking, okay, so why is the England government not doing the same strategies as Scotland and Ireland?
Yeah, no, that's a really fair point. Really fair point. I don't know. I mean, we'll never know. Maybe there's so many factors that come into play. Maybe like financially driven factors, or
I feel like because I feel like the UK government is only caring about their economy. They're not caring about people's lives. They're not thinking about others. All they're caring about is their money coming in, so they don't go into redundancy again.
No, I totally understand. So, I mean, how long do you have left on your isolation? Do you have to stay in isolation until your next test, or?
So NHS testing and tracing called me yesterday. They told me I have to self-isolate until Tuesday, the 5th of January. They said that I don't need to be retested again unless I have new symptoms, because they said that it can take up to weeks to get your taste and smell back. And I'm just like, my business is just going to go downhill now, because I can't bake, because I can't taste anything, and I don't want to give any of my food products to my like people, whoever they order. I'm just going to be like, I can't bake right now because I can't taste or smell, and I don't want to give you something that's not going to taste fantastic in my head.
So that's a really good point. So with regards to your business, bakery, what are you going to do, like, now that you don't have your taste or smell?
Right now, I think if whoever asks for an order, I'll just tell them to, like, I'm going to be very honest with them and say, yes, I did get COVID. Yes, I've lost my taste and smell, and I don't want to be providing a food product that I'm not going to be satisfied with providing to you. So yeah. And obviously I'm thinking of the safety of all the customers as well. So I don't want to, until I'm clear and I've got my taste and my smell back, then I'll start baking again.
No, I totally understand, and I hope you obviously recovers sooner than
Yeah.
later. Because
Yeah.
especially working in the NHS, like whether you say you only work in admin, you still have a big role to play. So
Yeah.
I do hope you recover soon. Okay.
Thank you.
So what are you guys doing for food?
Yes.
Like, are you ordering
Uh,
in?
so my sister actually just done the weekly shopping yesterday, so she just brought it to the doorstep and left pretty much. So yeah, so at least I've got an older sibling to help us out, so we're good. We're actually covered at least. And she's a GP,
Oh,
so she's been also advising me. Yeah, she's in the medical profession as well, and husband's a surgeon as well. So
yeah.
I've got family and friends that are in the medical field, and they're just praying that the public just for their own selves, just stay at home and take care of themselves rather than being like, oh, I don't care about what the government says, I'm just going to go out. Because I'm like thinking to myself, where can you go out? Because all the non-essential shops are closed at the moment, even restaurants are closed. So why are you even going out for? I can understand if you're going out to do your weekly shopping, but you don't need to be going every day out unless if it's work related.
No, I totally agree. But there are people having private parties and or other non-essential activity. Like, why are you
Yeah.
doing this?
I've seen it on my Facebook, like friends doing house gatherings, and I'm like thinking to myself, have you all been tested and you're that close to one another? Where is social distancing? Do you not know the definition of social distancing? It's
No,
like,
yeah.
if you want to do a gathering, at least do some social distancing, at least.
Yeah.
But none of them did. They were all hugging and singing along, and it's just like, you guys really don't care about anyone else but yourself. In my opinion, that's when I'm looking at it. So
No, I agree. I agree. Wow, like that's a shock. Like, hopefully, I'm literally like scared for you because obviously I've not had or
yeah,
felt or even lost. I think if I lost my taste, I'll be so devastated because I do love food. I don't eat a
I
lot,
love my
but
food.
yeah, I enjoy.
It's just like now, like my mom brings me a spicy dish, and I'm just like, it looks spicy, but when I'm putting it in my mouth, I'm just like, I'm not getting nothing. It's just like, oh, okay, it's just eat it.
No, yeah. But I'm sure he'll come back.
Yeah,
You seem really healthy and upbeat,
yeah,
so I hope he just stays in the upwards from now on. Um,
yeah.
so did you have any orders for your business prior to you catching obviously COVID?
I haven't got any orders recently. My last order was the 22nd of December, so I was okay then.
Mm.
So yeah, Touchwood, it was all right.
Okay.
Yeah.
Well, I do hope obviously when you get better, like you get loads more
Mhm.
and orders
Yeah.
in and
Yeah.
maybe I'll be
Yeah,
one of those
definitely.
people. The last thing you need is to make a
Yeah.
cake that you can't even taste and
Yeah.
or know when something is burning. Imagine making cake and then
Yeah.
it's like it gets to the point it's burning and you can't even tell.
It's like, oh no, great. But because I know like how many minutes that I need, like each cake order that I do, I'm just like, okay, so I have to put this in the oven for 20 minutes, it will be cooked. Because
Yeah.
just depending on the depth of the cake tin, so I'm like, okay with that. And even when I had my taste and smell before that, I was very, very self-conscious. I was like, let me not burn the cake. Okay, let me check it. And I was checking it every 5 minutes, and I'm just like, it's not going to be cooked by every 5 minutes. So, but yeah.
No, I understand. But it's a very weird way to obviously to start the new year. Today is the 31st. And
Yeah,
it's
I'm not
just
celebrating it with my family. I'm just in my
no,
room, and
you
it's
can
not a
just
nice feeling. This,
I don't know if there will be any lights, you know, lights
I'm
or
not too
shows that
sure if they're actually doing any fireworks this year, but we just have to wait and see.
but knowing this country, I'm sure they will say there are some fireworks you can watch online, but there will be people outside watching, trying
Yeah.
to social distance.
But that's
Very
that's not the yeah, it's so close, not like 1 meter
yeah,
or 2 meters. It's just like,
yeah, it's
yeah,
just
let's
like
just be
oh
together. Yeah,
No, totally. Are there any things that you're looking forward in the new year? Obviously, apart from getting better.
Well, obviously, I'm praying that my business grows. I'm also trying to get my logo finalized as well for my baking industry and like the company. So obviously, I'm just waiting on that. So yeah, I'm just hoping in the new year that the business will be thriving.
I'm sure it will be. Of course, it's all about work ethic and keeping at it.
Yeah,
And
yeah.
I doubt this is something you struggle with.
Mm-hmm.
Who is working on your logo? Because I do know some people that maybe can help you.
At the moment, it's just myself really working on the logo. So it would be
Okay.
great if you can send me some details over and
Yeah, for sure. To wrap this up, is there anything else that you want to, before you go, leave with people? Whether it's like staying safe and anything you want to get off your chest.
I just want to tell everyone to have a good new year, a happy new year. Stay safe, stay good and healthy, and just remember social distancing is crucial right now, as they have announced that it's going to be a crisis if we don't social distance. So please, 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 just for your family and friends, just social distancing, and hopefully we should have a good summer 2021.
Of course, you're looking forward to summer. Do you have plans? Do you plan on like traveling somewhere nice?
Unfortunately, I can't travel because I was trying to travel for my birthday, but I'm praying that everything goes according to plan because my cousin is actually getting married on my birthday. So I'm praying that
So to get into the questions, the first one is, do you prefer talking or texting?
Talking.
Okay. The last song you listened to?
The last song I listened to? Black Eyed Peas, Get This Feeling, something.
I love that song. I love the song. That's very old though. Like it's quite
I go into old school mode. I just go into complete old school mode. I'm just like, today's Throwback Thursday. Let's go into Throwback Thursday.
If this is how young you were. If your old school is Black Eyed Peas, I get a feeling that's just like early 2000s or 2010s or something. So you are still very young. Do you prefer invisibility or super strength?
Ooh, invisibility.
Why?
Just to see what people would do when you're not there.
Okay, it's so weird. I prefer invisibility so I can just walk around naked.
That's a good one. That's actually a good one.
I can't be asked with like getting dressed sometimes.
Yeah.
Okay. But it's good to know you want to be noisy. You can be noisy without being invisible.
Yeah, you can be, but then as well as that, it's just like, when you walk into the room and they go all quiet and it's just like, why are they going all quiet for? Were you talking about me? So,
okay.
Yeah.
Get it. Are you a morning or a night person?
Ooh, I'm both actually.
What does that mean?
I would say I'm a morning person. Yeah, I'm a morning person.
Okay. Do you wake up pretty early even when you don't have work?
Yeah, surprisingly, on the weekends, my brain just would automatically wake up at like 6 o'clock in the morning. And I'm just like, why are you doing this to me? Like, I don't have work today, but it just automatically, yeah.
Do you know what I do? So I am also a morning person, and something I've tried now is I wake up. If I wake up early, I'll put on Headspace, and then I'll put on like bedtime to go back to sleep. It does help. You should try it.
Yeah, definitely try it.
Yeah, so on the weekends, definitely put on, when you wake up at 6, put on Headspace, bedtime, and you should fall back to sleep. Okay. Last question. What's your favorite junk food?
Ooh, that's actually a good question. What is my good? It's Cheetos. Cheetos, like the spicy flavor, the jalapeno flavor.
Interesting. Wow.
Yeah.
I'm trying to think what my favorite
or it would be
junk food is.
my junk food would be like McDonald's, chicken mayo, and medium fries, and some apple pies as well.
I mean, I do love a McDonald's every now and then. My go-to at McDonald's is a kids meal. Don't judge me.
Ooh, nice.
I do love a kids
no,
meal.
I would definitely go. I would definitely love a little Happy Meal here and there. So even when you come to the drive-through window and they're like, "There's no kids in the car," so
yeah, you get Happy Meal. It's cheap. It's under $2.50.
yeah.
I mean, even if you didn't have a lot of money, you can still afford it. So I feel like even if I get really rich, I would just pull up to McDonald's and get myself a Happy Meal.
Same here. I feel like the same as well. I'll just go save a menu. That's it. Like,
I've got to save money. But of course, it's been lovely chatting to you, and thank you so much for your time.
Yeah, thank you for having me.
And I wish you all the best and Happy New Year. And I want you to recover soon, because obviously you work for the NHS and we need you to get back to work soon.
Thank you. So I wish you a Happy New Year, and you have a great, good health and wealth this coming year.
But thank you so much.
All right. Take care.
Bye-bye.
All right. Bye.